My name is Dr. Jim Krause, and this is another in a series of presentations that we are doing for the Center for Underserved Populations, specifically the Center for Health Outcomes in Underserved Populations. And we are funded by the National Institute for Disability and Rehabilitation Research. And what I want to talk today about is the prevalence of depressive disorders as related to race ethnicity, specifically comparisons of Caucasians and African Americans, and then the role of education and income in mediating that relationship. What we have displayed here is a mediational model of depressive symptomatology. And when we talk about a mediational model, we talk about an explanatory model where you observe one set of relationships that may be explained by another set of variables. In this case, you can see that aging factors are in our model, but we have them directly contributing to the outcome, which is depressive symptomatology. This is not the primary focus of the presentation, but it is considered within the design. You'll then see that we have gender and race ethnicity as a primary factor in the prediction of depressive symptomatology. And then there are two circles in between, one for years of education and one for income. And we are going to sequentially analyze this data in order to help us understand, first of all, are African Americans with a spinal cord injury more likely to report significant levels of clinically significant symptomatology of depression? And then we're going to look at whether that relationship holds when we first introduce years of education to account for the potential effects of differences in education between whites and blacks. And then secondly, we are going to look at the additional effects of earnings. The reason that we are doing this is because we know there are disparities in the general population and among people with SCI in both education and income. The next slide here shows the first stage of the analysis. And what we have is a logistic regression equation. And what we do with logistic regression is that it's very simple in that it summarizes the relationship between variables as an odds ratio. And stated simply, what we have is there is a reference group in each analysis. And in this analysis, our reference group is Caucasian male. And the value for that is set to 1. Any ratio is a comparison of one number to another. And then we're going to look at Caucasian women, African American men, and African American women in relationship to Caucasian men. And anything over 1.0 as an odds ratio would indicate that that factor was an added risk for having clinically significant depressive symptomatology. And as you look at the table, you'll see that Caucasian women have 1.15 times the odds of men, but that is not statistically significant. And you'll see the confidence interval, which it would indicate, being that the lower value is less than 1, would indicate that that's not statistically significant. In other words, we're not confident that that's unlikely to have happened by chance. If you look at the odds ratio for minority males or African American males, which is predominantly that group, you'll see that you have a 1.85 odds ratio, which is highly significant, meaning that the minority men in this sample had 1.85 times, nearly twice the odds of depressive symptoms when compared with Caucasians, and African American women had 3.37 times higher the likelihood of the clinically significant symptomatology compared to Caucasian men. And those are both highly significant, which means that we do not anticipate that they occurred by chance alone. In the next slide, what we've done is we've extended the analysis. So now that we've established the relationship between race, ethnicity, and gender with depressive symptoms, we're going to see how that changes, if at all, when we introduce years of education. When you look at the gold, you will see that the values for minority males and minority females are now somewhat lower but highly significant yet. In other words, the education did appear important in reducing their values somewhat, but they don't fully mediate the relationship. In other words, the relationship between race, ethnicity, and depressive symptoms has not gone away. If you look at years of education, you'll see that compared to people with more than 16 years of education, those with less than 12 years of education and those with exactly 12 years of education both have a greater risk of depressive symptoms. So education is an important factor, but it does not account for the differences in depressive symptoms as a function of race, ethnicity, and gender. Now in the final slide, again, I'll draw your attention to what is in gold. And now you see minority males, there's no star, which essentially means it's no longer statistically significant, because now we've accounted for the differences in both education and income. But you'll see that for minority women, the relationship still exists, which means essentially that compared to Caucasian males, that minority women are the highest group among the four groups in terms of the odds of depressive symptoms, and it does not go away with socioeconomic factors. So there's something different that appears to be happening between men and women and between African American men and African American women. And so that means that simply future research needs to do more, look at more variables in an attempt to explain this. In closing, I just want to summarize by saying it's very important that we look at different outcomes in SCI and other disabling conditions, and that we always consider racial ethnic factors because we know there are disparities in the general population. We typically would look at factors like education and like income because they're socioeconomic indicators, and sometimes those indicators are also associated with factors such as access to care. That did not fully account for the relationship in the current study, but it is important to know socioeconomic factors do mediate the relationships between race and ethnicity and depression for males, to some degree for women, but we still need to do more research in this area. Doing effective research and understanding the causes and contributory factors for outcomes such as depression is our key to intervention, and that's our goal. We want to make those differences go away. We want to improve outcomes for all people with SCI. Thank you.